We all think about, infections, a cold, a urinary tract infection, a colitis, something that gives bacteria to our own bloodstream, and then that seeds itself on whether it's a knee, hip, or breast implant. That's the common teaching, for clinicians. But in this case, it's like being on an episode of House. So the triathlete now has 4 types of fungus and multiple types of bacteria. And so I had to start looking up some of these because I didn't recognize some of the fungus, and they're all consistent with water. And so if you think about how this would happen, a triathlete swims, gets out of the water and runs. Many of them run barefoot. And you get little micro punctures in your foot, or your foot's cold because the water's cold. You can't feel things. You get a little puncture. It's easy to see how you get a blood-borne contaminant this way that then will subsequently end up in a joint or in an implant and cause a inflammation slash infection. And so for her, it made a lot of sense to me. Conveniently, about 2 weeks later, I had a patient show up with a report after an explant that had Acinetobacter. And so for those who don't know what Acinetobacter is, it's a bacteria commonly found infecting severely burned patients or immunocompromised patients. My experience, having done burns for a large portion of my career, I most commonly saw it in burn patients. Nobody's sicker than a severely burned patient. Really, really challenged nutritionally. Skin envelopes damaged, has to go have their skin excised that's been burned, replaced with cadaver skin temporarily before they can skin grafted. They develop infections because the immune system's severely compromised. The integument, or our skin, which protects us from infections, severely compromised. So I asked this client of mine, what was she doing that she could have possibly got Acinetobacter? I'm like, were you gardening or digging in soil, or what exactly were you doing? And she said, well, I just stay at home, or stay at home mom. And I was like, okay, would you have been in mud for any reason? And she says, oh, I used to do Spartan racing. And well, there you have it. So this is a soil bacteria. It gets under your nails, or once again, you get a puncture in your hand, it contaminates you. And this is how you get it into your bloodstream, and it affects your, like I said, your joint, or whether it's a knee, a hip, or a breast implant. So these all made sense now. And we have never known these things without using PCR testing, because regular lab testing you would get in, like I mentioned, a CLIA-based lab like Quest or LabCorp, some of these other places, CPL in Austin, they're not performing PCR testing. It's just a swab and a growth on an agar plate, and that's traditional. So, having made these inroads with PCR testing to, as definitively diagnose something as possible is giving me great comfort. So when I see these reports, I'm like, well, this is basically why you're having your problems. And then it's not the end of the story, but for that portion, we can help close that chapter.